type 1 diabetes, the one that we have to talk about today. My first question on this topic, type 1 diabetes, how did they start classifying this diabetes when they did not have an adequate definition? They defined diabetes as a chronic condition where there is elevated blood glucose. So if you have elevated blood glucose levels, you are diabetic. But most of you have high glucose levels every time because of what you've been eating. Most of you have high insulin in the system because of what you've been eating. Because you're always in a feeding state, you never fast. So if somebody ate a cake right now, if I take their blood sugars 15 minutes to 30 minutes down the line, their blood glucose is high. That is hyperglycemia. That is not diabetes. I am putting that point there so that you know this. What did they tell you about type 1 diabetes? They told, personally, I was told, because this is what I was taught, that type 1 diabetes is, first of all, an autoimmune condition. Underline the word autoimmune, because that's the topic of the day. So it is an autoimmune condition. And an autoimmune means that your own immune system or your own immune cells, the white blood cells, are actually targeting your own body tissue or cells. So when you hear autoimmune, it's nothing new. It's just your immune system targeting your own system or your own tissues and cells. Now, there is no single day you will wake up and your immune system just decides, today I'm going to target the liver. Today I'm going to target the pancreas. There is no single day. That cannot happen. The same immune system that is supposed to protect you starts targeting you. No way. There must be something that is going wrong to make sure that this immune system does not recognize your own cells, because the immune system works by recognizing. So it has a memory of every single cell. That's why it's always good to get an exposure to a disease. Don't sanitize surfaces that your child plays on, because that exposure to that microorganism will actually sensitize the immune system that, hey, this one is a foreign one. And the immune system will keep the memory so that the next time you get that exposure, it attacks it with ease. So you'll not need medication. You'll not need hospitalization, because your immune system can handle that. So if you always, that mother who blocks your child from playing outside, who always sanitizes the surfaces of your child, you're actually limiting the immunity of this child. The immunity of this child is being messed up. And remember, you're also feeding this child with sugar. So you're killing the immune system of this child and also inhibiting the immune system to even rejuvenate. So you're sanitizing all the surfaces. When will your child ever get in contact with fur from the pets, with dirt, with microorganisms that are coming, with the pollen? And then as you sanitize those, you realize your child is becoming weaker by day. Your child is full of allergies, skin allergies and respiratory allergies, including asthma. Your child is always full of eczema. You're always treating your child with antihistamines. To add on that, you're always giving your child antibiotics. And you even tell the doctor, I want the original ones. Give me that original antibiotic, and you give it to your child. It kills all the good and bad bacteria in your guts, in the gut of the child. Now that is killing the immune system. And now your child cannot even, the immune system cannot even recognize new bacteria. So anytime the child gets an exposure to bacteria, of course, it's hospital admission. And now they come out of the hospital, you're still doing the same things. Of course, sometimes I can't blame you because you don't have the information. But it's only fair that you understand what you're doing to your child. So listen, they did not define diabetes adequately, but they classified it. They classified it. So they told you there's type 1, and type 1 is an autoimmune, so that your immune system starts targeting the beta cells in the pancreas and now kills them. When it kills these beta cells, the pancreas is unable to produce enough insulin or even insulin to help you regulate blood sugars. Now listen to this point. Let's go back and define what diabetes is. Diabetes is not high blood sugars. It's actually sugars in the system, basically in the cells. So this is the fat cells, this is the liver cells, and this is the muscle cells. When they are filled with glucose and it's not being utilized, that is diabetes. What you see in blood is a symptom of diabetes. That is hyperglycemia. Taking that in consideration, Help me think. How then did type 1 diabetes become diabetes? Relax, wait a minute. Let me just be clearer here. So we need glucose in the cells. We need them to be filled. We need them to not to utilize this glucose. So it's just there but not being utilized. We need at least to eat carbohydrates so that we get the glucose and then we pump this glucose into the cells for utilization. But until that happens, there's no diabetes. There's no diabetes. Listen to me keenly. We need glucose, yes, for utilization in the cells. But if your cells are not utilizing glucose, but you're still pumping glucose into these cells, that is diabetes. How did we end up saying that a person who has no insulin or less insulin, at least for that one who has less insulin, we'll talk about him. But how did we end up saying that a person who has zero insulin is diabetic? How? In the first place, this gentleman did not have a chance to pump any glucose from the blood into the cells. So no insulin. So how did they become type 1 diabetes? How? Let's do this. If you give birth to a child, and then this child takes breast milk has glucose, has cholesterol, and all the nutrients that the child requires for their growth. So this child has never had insulin production, but they are taking breast milk, which has glucose. Where is that glucose going to? Hello? Where is that glucose going to? Now, this child was not diagnosed of type 1 diabetes from the time they were born. No. It is most times diagnosed when they are teenagers. These are children who have been eating sweets, cookies, cakes, biscuits, and all those confectionaries. But they never suffered any form of attack until they are into their teenage. That's when they went to hospital. They are maybe losing a lot of weight. They are maybe having high glucose in their system. They are maybe urinating glucose in their urine. They are even producing that fruity smell in their mouth. They even had ketoacidosis. Perfect. And then now they went to hospital. When they went to hospital, all these things were done. Now they were diagnosed of type 1 diabetes. And by the way, did you know there are adults who are actually diagnosed of type 1 diabetes? Where did it come from? Did it just from nowhere? Now your pancreas is not functional and now you have issues with type 1 diabetes. My friends, if you start listening to these things carefully, sometimes I think this is a scheme to just, and it was put in the syllabus. When it's just put in the syllabus, it actually conditioned doctors to think nowhere apart from the syllabus and the guidelines. Was this a scheme to just market insulin therapy? Was it? Because again, listen to this. If somebody is type 1 diabetic, the way they've classified it, if somebody is type 1 diabetic, and then they are put on insulin, they are told this insulin will be for a lifetime. Organs do shut down. For example, if you have asthma and you continue using that inhaler that has steroids, you continue getting that injection for a steroid, what you will do is you will actually tell the adrenal glands that produce natural steroids that you don't need them, that you can do without them. So you're telling those organs that, hey, I have an external supply of steroids, so you don't need to produce it anymore. And you end up getting into adrenal insufficiency because the adrenal gland shuts down, does not produce adrenaline, does not produce aldosterone, does not produce those hormones that actually help you in stress, the cortisols, which are the natural steroids, cortisol and aldosterone. So they shut down. It shuts down, it stops producing them because you're bringing it from outside anyway. If you give me insulin, you're actually telling me, you're telling my body that the pancreas has no role here. It has to shut down. So the more you give me that insulin therapy, the more you shut down my pancreas. And remember this, they even told you that type 1 diabetes is juvenile diabetes. Happens in children and adolescents. That's when it's diagnosed. But you know very well, if a child breaks their leg, they don't need a lot of time before that leg goes back to normal. Which tells you their cells are rapidly multiplying. Okay, their cells are rapidly multiplying. So they do not need too much time to get the healing. Now, as a child, of course, your pancreatic cells are rapidly dividing. Now, guess what? You give me an external shot of insulin, you shut down the pancreas, there is no rejuvenation of the pancreas at all, and now I become a slave to that insulin therapy for a lifetime. You actually brought in the problem. And now you tell me to get the solution in your insulin. Now, this is the other point. For even those who are type 2 diabetic, there's this drug that has a combination of metformin and sitagliptin, 50/1000. If you have ever taken that drug and you're a diabetic, kindly put it in the comment section so that somebody knows what drug this is, so that they know what I'm talking about. And I will correct you. That drug called sitagliptin, it comes from a group of drugs that are called gliptins. One side effect of the gliptins is pancreatitis and pancreatic cancer on the extremes. Let me give you a second to think about it. Imagine you take a drug combination of an anti-diabetic agent that actually causes pancreatitis and pancreas failure, pancreatic cancer. So you give me a drug that causes pancreatic shutdown. But the pancreas is the one that is supposed to regulate my blood sugars. So when they go up, the pancreas gives me insulin to bring it down. When they go down, the pancreas gives me glucagon to bring it up. Now you give me a drug that shuts down the pancreas. What are you telling me? You are telling me that I'll be on insulin therapy for a lifetime because now I cannot produce insulin. You're telling me if my blood sugars go down, I will have to rely on you to give me glucagon injection so that my glucose goes up. So if you're on that drug, I've always maintained that if you're diabetic for more than 6 months, you are the problem because you are eating yourself to where you are. Please change the diet. You cannot manage dietary conditions with drugs and medicines. You can't. You can't. So back to type 1 diabetes. Question 1. I have no idea how we ended up classifying diabetes. Question 2. I have no idea how somebody who has never produced insulin became diabetic. And they never realized this until they got into their teenage. Number 3. There are so many factors that can actually cause a failure or a degeneracy in the pancreas. This is a teenager. They eat a lot of things. They experiment with a lot of things. How then shall we just roll down and say, this gentleman, because we took one test and we realized they have very minimal insulin and we judge them and we said, this one is type 1 diabetic. And then insulin therapy for a lifetime.